Newborns breathe in ways that can stop a parent's heart for a second. One moment they're breathing fast, almost too fast. The next, they pause completely, as if holding their breath. Then suddenly you hear a grunt, a snort, or a strange whistle from the tiny nose. It's confusing, it's scary, and every sound feels like a warning. Many parents spend nights watching their newborn's chest rise and fall, wondering if this is normal, or a hidden danger. This video begins with a simple truth: newborn breathing is weird, but not always worrying. Still, some sounds are silent alarms you should never ignore. So how do you tell the harmless noises from the dangerous ones? By the end of this video, you'll understand the difference clearly, and you'll never feel helpless listening to your baby breathe again. Newborns aren't born with perfect lungs. Their airways are tiny, soft, and still learning how to work. Their breathing muscles are weak, their rhythm is irregular, and their bodies switch between fast and slow breathing without warning. That's why newborns can suddenly take 60 breaths in a minute, then pause for 5 seconds, then start again like nothing happened. Parents often panic the first time they hear these strange patterns, especially late at night when every sound feels louder. But most of these differences come from the baby simply adjusting to life outside the womb. They are still practicing how to breathe, how to clear their tiny nose, how to regulate airflow. Understanding this helps calm that first wave of fear, because not every noise means danger. It just means your baby is new, delicate, and still learning to breathe like the rest of us. It's shocking how loud a tiny baby can be while doing something as simple as breathing. But many strange sounds are completely normal. Fast breathing happens because babies have small lungs and need more oxygen. Short pauses are simply the developing brain adjusting the rhythm. Light grunting helps them expand their lungs. A soft whistle often means their little nostrils are slightly blocked with milk or mucus. Hiccups. That's just their diaphragm learning how to work. Even snuffling after feeding is normal. Babies swallow milk, tiny air bubbles, and sometimes a bit of mucus. These everyday sounds can scare parents, especially new ones, but most are harmless and part of healthy development. The key is that these sounds come and go, and the baby looks comfortable. If the baby is calm, feeding well, and breathing without effort, these weird noises are simply the soundtrack of a growing newborn. Some sounds and signs are red flags parents should never ignore. If a baby's chest sinks in deeply with every breath, like the ribs are pulling inward, that means they're working too hard to breathe. Constant grunting is not normal. It's a sign the baby is struggling to get enough air. Blue lips or tongue mean oxygen levels may be dangerously low and need urgent attention. Flaring nostrils show the baby is trying to pull more air in with every breath. Very fast breathing that doesn't stop, not just a few seconds, is a silent alarm. And if the baby has zero pauses, breathing non-stop, fast, and with visible effort, they may be in respiratory distress. These signs mean breathing isn't just noisy, it's difficult. Parents should never wait, never guess. This is the moment where getting help quickly can make all the difference. Every parent has a story about a night they couldn't sleep because their baby sounded different. One mother remembers hearing her newborn grunt softly every few minutes. She assumed it was normal newborn noise, until the grunting became constant. By the time she reached the hospital, her baby was struggling for air, and doctors told her she came just in time. Another family faced the opposite situation. Their baby made odd whistling sounds at night, and they panicked. They rushed to the ER, only to find it was harmless nasal congestion. The baby was perfectly fine. These two stories show the truth. Sometimes sounds are nothing, and sometimes they're warnings. The challenge is knowing the difference, and that's exactly why this video exists. Not to scare you, but to give you confidence. When parents understand breathing signs, they react smarter, faster, and safer. Parents often ask, "When should I worry?" The answer becomes clear when you know the danger signs. If your newborn's chest pulls in sharply with every breath, don't wait. If the baby's breathing becomes extremely fast and stays fast, get help. Blue lips or face are an emergency, oxygen is low. Constant grunting, not the occasional normal grunt, is a sign of respiratory distress. If nostrils flare open wide with every breath, the baby is struggling. If the baby is unusually sleepy, feeding poorly, or seems too weak to cry, these are serious signals. And if your instincts say, something is not right, trust that feeling. Babies can't speak, their breathing tells the story. Quick action can save a baby who's struggling. It's better to check early than regret later. Doctors expect parents to come in. Your concern is never a burden. Parenting a newborn often feels like living between love and fear. Every breath, every sound, every tiny change can feel like a warning. But now, you're not in the dark anymore. You know what's normal, and you know what's not. You know when to wait and watch, and when to act fast. Remember this: no doctor, no expert, no book knows your baby the way you do. Your instincts are powerful. When something feels wrong, it's worth checking. And when everything is normal, you can finally relax and breathe with your baby. Newborns make strange noises, but most of the time, those sounds simply mean they're growing, learning, and adjusting to the world. As your baby's breathing becomes stronger and more steady, so will your confidence. You're doing an incredible job, and now, you understand your baby's breathing better than ever.